Thank you for joining us for our Tuesday version COVID-19 briefing, where we discuss our efforts to fight COVID-19 and to gradually open the door to our state's economy in a safe, methodical, and data-backed way. As we think about opening our economy, we cannot stop thinking about social distancing. It works. And social distancing practices like frequent hand washing and good hygiene, wearing a mask where appropriate, those things will ensure that we can stay on track with our safe reopening plans. In 89 of our counties, we see businesses today taking the Tennessee Pledge and opening at a limited capacity. Restaurants are beginning to open. Retail outlets are set to open tomorrow. And today we're announcing that gyms will be allowed to reopen on Friday. We'll say more about this guidance shortly. I've invited Commissioner Ezell of our Economic Recovery Group to speak about this process in a few minutes. The Tennessee Pledge asks businesses to open and provide an environment that is safe for their employees and for their customers. And the pledge also asks employees to work in a way that protects themselves, their coworkers, and the customers that they serve. And we're giving them very specific and detailed tools and guidelines to help them do just that. While many Tennesseans will start the process of safely returning to work, we want to encourage all Tennessee businesses, particularly those who have utilized stay-at-home work practices, to continue to do the same wherever possible. Every business in Tennessee has a responsibility to create a safe workplace. We have universal reopening guidelines available at TennesseePledge.com, and we ask every Tennessean to engage with these resources. Even if you're not working in one of these businesses or opening one of these businesses, you will be engaging in these businesses, and so we ask you, all Tennesseans, to engage and look at the guidelines at TennesseePledge.com. We want to recognize businesses that are doing right by their employees and by their customers. And today I want to give a shout out to a couple of those. Champy's Fried Chicken in Chattanooga has implemented procedures, safe working procedures to open their doors. Picasso Bistro and Pizzeria in Jackson, taking very safe reopening precautions for their dine-in services. Soon, businesses all across the state like these will be able to display a poster in their window if they're abiding by the guidelines outlined in the Tennessee Pledge. In addition to guidance today, I want to share more about the stimulus funds that our state has received and our work to cover uninsured Tennesseans facing COVID-19. First, the numbers. Today, we have had 10,052 confirmed cases of COVID-19 in Tennessee. That is a 1.35% day-over-day increase over yesterday. 188 Tennesseans have lost their lives to COVID-19. 4,921 Tennesseans have recovered. I want to talk a bit about gym guidance. Today, we've released guidance for gyms in Tennessee to begin to safely operate. We feel that it's important for the mental and the physical health of Tennesseans to have access to fitness environments. Under the Tennessee Pledge guidelines, gyms in 89 of our Tennessee counties will reduce capacity to 50%. They'll close communal spaces like athletic courts and locker rooms and swimming pools and self-service areas like juice bars and coffee stations. Fitness classes will also reduce by 50% and will utilize social distancing and remove shared equipment. These are just a few examples from our full guidance for gyms that can be found at TennesseePledge.com. It includes information for all businesses, for customers, and employees. Today, I also want to provide an update about stimulus funding in Tennessee. We're very fortunate for the leadership from the White House, along with our federal delegation, for the multiple forms of funding that have been available to us, provided through the CARES Act and other pieces of legislation. They've set aside significant funding that goes directly to hospitals and businesses for economic relief. That funding won't require additional state action or appropriation to become effective, but we want to work with those organizations to make sure that those Tennessee entities are accessing those federal funds that are available to them. The funding that Tennessee is receiving directly can be divided into two categories. The Coronavirus Relief Fund, which is $2.3 billion, and it's our most flexible source of funds. The second source of funding includes several increases to the federal share of existing programs in our state, and those funds will be restricted to the uses in those particular programs. What all this funding has in common is that it has to be used on new spending this year. So we'll be working to structure the funding in a way that it doesn't create new obligations to the state that the budget cannot afford in the next years. With over $2 billion in one-time spending, we have to also align those priorities, that spending. Yes, that a portion of these funds will be utilized to address the cost of COVID-19 treatment for the uninsured. Healthcare providers treating the uninsured will file claims with the federal government and be reimbursed for that treatment provided on or after February the 4th. We're very pleased by the recent action at the federal level and are committed to the treatment and care for any uninsured Tennessean that falls victim to COVID-19. To that end, we're committed to utilizing the $30 million in state funding through our Division of TennCare to supplement those federal dollars. Again, during this COVID-19 emergency, we need all Tennesseans to seek appropriate medical testing and treatment to better ensure their own safety, but also the safety of their families and their neighbors and all Tennesseans. This available funding for COVID-19 treatment will certainly help us meet this objective. And I've asked Stephen Smith, the Director of TennCare for our state, to be here to answer questions during the Q&A portion regarding funding for the uninsured. Stimulus funds can also be used to support a system that rapidly responds to the concerns of our citizens or the needs of our citizens so that their activities can continue safely. For example, funds can be spent on continued PPE purchases, and we can use these funds to support public access to those types of resources. And finally, we have to make sure that our taxpayer dollars are being used wisely. This crisis has placed new demands on state and local governments. To the degree that new spending is required by those governments to support the response, we need to address that burden so that we can remain fiscally stable in the years to come. For instance, our prisons, our schools, and other public agencies will all have to adapt to a way of doing business that incorporates new safety guidelines. That incorporation will come at a cost. And to the degree that we can use these federal funds to provide for these adaptations, the more that we can reduce the strain on our state and our local budgets, and we'll be doing just that. To ensure proper stewardship that serves Tennesseans well, we're working with a bipartisan stimulus accountability group that we announced earlier. And I want to thank the members of that group, Lieutenant Governor McNally, Speaker Sexton, Senator Watson, Senator Ackberry, Representative Marsh, Representative Love, and Comptroller Wilson for their service in these efforts. Additionally, accountability group that we announced earlier. And I want to thank the members of that group, Lieutenant Governor McNally, Speaker Sexton, Senator Watson, Senator Ackberry, Representative Marsh, Representative Love, and Comptroller Wilson for their service in these efforts. Additionally, accountability group that we announced earlier. And I want to thank the members of that group, Lieutenant Governor McNally, Speaker Sexton, Senator Watson, Senator Ackberry, Representative Marsh, Representative Love, and Comptroller Wilson for their service in these efforts. Additionally, the Coronavirus Relief Fund expenditures are all subject to oversight by the U.S. Treasury Inspector General. We are committed to wise stewardship of this funding from the federal government and to use those funds in a way that will serve every Tennessean. I'd now like to ask Commissioner Ezell to give his report regarding the work being done by the Economic Recovery Group. Commissioner Ezell.
Thank you, Governor. I'm pleased to share some important updates from the Economic Recovery Group today. Because of the incredible work by our health department, employers and employees, the Unified Command, and Tennesseans, we have begun the careful process of getting back to work safely. Yesterday, a number of restaurants in 89 counties were able to reopen their doors, and others still are working on their plans to reopen. And tomorrow, retail stores in those same counties reopen at a 50% capacity with safety as the #1 priority. Businesses want to do this the right way, the safe way. They are taking this responsibility seriously, and for that we applaud them for putting the safety of all Tennesseans first. And yesterday's beginning proved that. So today we released the new guidance for gyms and fitness centers effective May 1st. This guidance was created in consultation with small gym owners as well as large fitness centers with multiple locations across the state, and with the Tennessee Department of Health. Tennessee Pledge includes guidance for exercise facilities to reopen with added safety measures, as the governor has mentioned, like employee screenings, temperature checks, and adaptations to allow for social distancing. We do want to give Tennesseans a safe place to maintain their commitment to fitness. And for full guidelines, please go to tnpledge.com. for all the information. Since the ERG was established in mid-April, we've worked around the clock with industry leaders, health experts, state and local partners, and legislators to develop the Tennessee Pledge, a careful plan to help Tennesseans get back to work safely and restore the livelihoods in those 89 counties. And then separately, as the governor asked us to, we are communicating daily with the mayors of those 6 counties, Davidson, Knox, Madison, Sullivan, Hamilton, and Shelby, who will work on creating individual plans and working in consultation with their own health departments. So thank you to the business leaders that showed again yesterday, along with the Unified Command, the team of medical experts, for your careful guidance in how we opened yesterday. And we know that the actions we saw yesterday proved that Tennesseans can work together to protect our businesses, employees, guests, and the livelihood of all Tennesseans by following the Tennessee Pledge. Along with the governor, I'll be happy to take questions.
Thank you, Commissioner. And before we do questions, I'd like to ask Dr. Piercy to come up and give her health report, please.
Thank you, sir. Good afternoon. I've got a couple of numbers to share with you today that I think are remarkable. One is 10,052. That's the number of cases, and that's a lot, but it shows a significant slowing of our growth. As the governor mentioned, 1.35% day-over-day increase is our smallest ever. But I want to talk about trends in just a minute because we have to keep that in context. The other number I want to talk about is 161,928. That's how many tests we've done. I also want to note that all but about 25,000 of those have been done in the month of April. That means about 135,000 tests have been done this month. That's about 2% of our state's population. And if you'll remember, President Trump asked last night for states to do 2% of their population of testing each month. We've already done that in the month of April, and we're making plans to do that going forward. Now, just a word about trends. While I did make a point that our day-over-day growth was the lowest ever, I want to put that into context. When we look at trends, we look at several days in a row. One day does not a trend make. And so you have to take that into context, and you have to expect that to go up a little and down a little. That's all expected and all exactly what we expect to see and want to see. So don't get too excited positively or negatively when you see numbers fluctuate a little bit. It's the overall trajectory that we're looking at. In addition to the daily growth rate, which does fluctuate based on the high yield groups that we test. For example, if we test a prison that has a lot of positives or some other kind of contained facility, we've seen that over the last few days. We expect those numbers to go up. And then when we test more widely, like in a general population, probably reflective of the numbers today of the testing that we did some over the weekend, maybe on Saturday, we see a lower growth rate. That's why we look at this over time. Secondly, we also look at the overall positivity rate. Now that number fluctuates less, but we are also continuing to see a downward trajectory in that. That's essentially the total number of cases divided by the total number of tests. That's our overall positivity rate. It used to be in the 8 and then 7 and then upper 6 range for quite some time. Now it's in the lower 6 range, 6.2, I believe. We're also looking at our metro areas separately. They're valuable parts and vital parts of our state, but when you look at the population, particularly the density and the travel patterns amongst metro populations, those are a bit different than our rural and more sparsely populated areas. So we look at those differently. We look at several different metrics every single day, but I did want to give you some insight into the ones that we're looking at today when we're talking about reopening. I also want to talk about the importance of wearing cloth masks, particularly as we start to move about more and businesses reopen. And you'll probably remember that we had a model with our Tyvek suit several weeks ago, so we've asked him to come back to model the appropriate use of a cloth mask. This is Director Patrick Sheehan, very illustrious director of TEMA, here to illustrate the proper use of a cloth mask. So you want to cover your nose, your mouth, and your chin. You want it to fit snugly but comfortably against the sides of your face. You want it to be secured with ties or ear loops, and you want to wash it regularly. Now, what not to do? Don't wear it as a visor. Don't wear it as a necklace. And the thing we see most often, don't wear it as a goatee. Thank you. While wearing a cloth mask is no joking matter, we did want to give you a little lighthearted example to help you remember the best way to wear a cloth mask. So next time I'm out in public at the grocery store, I hope to see you wearing yours there.
Thank you, Patrick, especially. Thank you, Dr. Piercy. And thank you all for allowing us to remind folks about just how important these social distancing practices are as we move into this next phase where we are committed to public safety, but encouraged about the opportunity to get Tennessee Inspect to work. We will open up for questions. Dr. Piercy, of course, is here. Members of our Unified Command, TEMA, Department of Military, Stephen Smith with our Department of TennCare is here, so we will open up the lines for questions.
Thank you, Governor. First, we'll go to Kim Crucy with the AP. Kim, your line is open.
Hi, Governor. So,
Hi,
as more of the state prepares to reopen, I was wondering what your guidance or how you are handling the state's more touristy areas. Gatlinburg comes to mind, other, high tourist attraction areas. Are you encouraging people to visit these places? What's been the guidance, or do you think the public should be flocking to this area even while trying to manage social distancing?
I'm going to let Commissioner Ezell speak to that, but broadly, what I'm going to say is no matter where you are in Tennessee, Tennesseans have got to stay committed to social distancing. Whatever activity Tennesseans are engaged in, they have to stay committed to this concept of social distancing. So the limited number of businesses that are opening in a very limited way, they are committed to that, and the people that engage with those businesses should be as well. So, Mark, you want to make additional comments about tourism areas? Most of those facilities are.
Well, what the governor said is correct. Those restaurants in Gatlinburg have begun opening this week, and retail stores are going to be opening tomorrow. The leaders of Gatlinburg are interested in how they can be building plans for all their businesses to be opening. But as we have a careful, phased approach, we're first doing the restaurants well, and then we'll do retail well, and the Gatlinburg leaders and many others across the state are continuing to work on their plans to how to be ready to practice those social distancing, those safe measures of the Tennessee Pledge when it's appropriate for those businesses to open.
So that's guidance for people inside Tennessee. Do you have anything, or what do you say to those people who might be traveling, who might want to travel from outside the state to Tennessee?
Yeah, well, what I would say is that in the same way that for the past 6, 7, 8 weeks, we have asked folks to be committed to not gathering in groups, and we continue to do that. That continues to be in our guidance. To not find themselves in social settings where groups of people come together. To now we're asking people to wear a mask in public areas where they're coming in contact with other people. All of the ways that folks know are complementary or a part of social distancing practices. That's what I'd say to anyone that's out in any place across our state.
Thank you, Governor.
Thank you.
Next, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Hey, Governor, you've got to do the mask demonstration next time.
No, it's not. No, you don't want me to do that, Natalie.
Director Shan did great, though.
He's a much better model than I am.
My question is, when your executive orders on the stay-at-home measures expire tomorrow night, it appears there effectively won't be any restrictions on holding social gatherings, sporting events, other large gatherings around the state. And for that matter, no restrictions on the other types of businesses you all haven't mentioned yet, like salons reopening. Is that accurate?
Yeah, we actually will be reissuing an executive order to replace the one that is in place now, and that'll address all of the issues that you're talking about regarding gatherings, which venues are not allowed to open, the continuation of the closure of close contact businesses. So that executive order will replace, there will be an executive order that replaces the one that is expiring, and it'll give new guidance that'll include the opening and the safe reopening of the business specified and continue the closure of those that are not yet allowed.
So to clarify, you said you won't extend the stay-at-home order, so you're going to put out a new executive order speaking to which businesses can't reopen and which types of venues can't hold gatherings.
Yeah, and it will actually speak to a wide array of social distancing guidelines as well.
Okay, and then another question, will you step in to overrule places like Davidson County and Shelby County if they decide to wait a while longer before reopening businesses?
I've said and continue to, and I talked to one of those municipal mayors this morning, continue conversations with those mayors, with those health departments. As you know, the health departments actually are the ones that make the decisions for those 6 counties that don't fall under the 89 counties that have state health departments. We're working with those. Our economic recovery group is working with their groups to create plans that are complementary, and we expect that that's going to happen. We know it is already happening, and we expect that's going to happen over the next few weeks.
What happens if weeks go by and Nashville is still not there yet, or in Memphis they still don't feel like they can move forward with opening businesses? What's your role going to be?
That's hypothetical, and it's a situation I don't think is going to happen. We certainly will address circumstances as they come up, but I'll say right now, the working together of the leaders across this state has been unique from what I can tell about what's happening in a lot of states. I've been very encouraged with the leaders of those 6 counties and how we've worked together. I don't anticipate any problem that way.
Thank you.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your line is open.
Yes. Yeah, Governor, can you hear me?
Yes, sir.
Yes, I was wondering, considering that the legislative staff is being called back in next Monday to work, yet your administrative staff is not being called back until May 26th. I mean, what is the line of thinking there? Why are you waiting so long to bring your staff back if you feel it's safe for others to go back to work at non-essential places and other offices?
You know, Sam, we're encouraging anyone who feels like that they can get the work done with a stay-at-home strategy to do just that. Those businesses are encouraged to continue stay-at-home practices. That's why the state's going to continue for the bulk of its employees, the ones that are currently working at home, to be at home. The legislature will make their own decisions about which employees it deems necessary to be in certain working circumstances. That's how all businesses and all entities will operate. For those that they believe are necessary to be on site to work, then we encourage them to do that in a way that's practices social distancing and provides for the safe workplace. And that's what we'll be doing at the state as well.
Next, we'll go to Jason Reynolds with the Murfreesboro Post. Jason, your line is open.
Hello. This first question is for Dr. Piercy, and then, well, actually both are. Recent reports said that the state is recruiting contact tracers from local health departments and academia. Will the tracing be done as a partnership between the state and the local health departments? And will the local media have a chance to talk to the local tracers to see how the process works?
So I had a little trouble hearing the first part of your question, but I think you're asking about the process for contact tracing in our local health departments. And
yes,
okay, sure.
I understand that they're going to be recruited from local health departments, state departments, academia. And so will this be a partnership between the state department and the local health departments?
Sure. So we employ, the State Department of Health employs contact tracers, what we call disease intervention specialists, actually on a full-time basis, because we track communicable disease, whether it's foodborne illness or measles, or other types of diseases. That's ongoing work all of the time. So some of that staff is already in local health departments. As we've talked about before, we have significantly ramped up our workforce, not only within existing employees by repurposing their duties, but also, I think it was last week, we talked about bringing on another couple of hundred state employees who volunteered to be temporarily reassigned to these duties. We actually are already in the planning phases of another cohort of contact tracers to bring them on. As our caseload grows, we know that not only testing, but also contact tracing are vitally important to making sure we keep this under control as we start to reopen. So to answer your question, absolutely, we'll be working